As designers, we carry a huge ethical accountability, whether we're designing a new public health program, better environmental regulation, a grant program to accelerate renewable energy uptake, or ways of getting services to the most vulnerable in our communities. If we get it wrong, we can create unintended consequences that harm people or the planet. When we get it right, we improve the lives of sometimes millions of people and contribute to better futures for our children. So a lot goes into getting it right, and I won't cover it all here. The piece I want to talk about is how we go about designing ethical systems, not IT systems, although technology is ubiquitous through our lives. I mean, the big social, economic, ecological systems that shape our lives and create our experience of society. When we're asked to help design solutions to a complex challenge, say creating better healthcare interactions when a patient is getting a serious diagnosis, as an example, we may find that our clients are often stuck in their piece of the larger puzzle. They want a solution where the problem lives, and for them, the problem lives close to where they live. In this example, at the point of diagnosis. It's human nature to be parochial, to imagine that one's bit of the problem is the whole problem. As a designer, you have to be a disruptor of this bias. You have to be able to zoom out, see the broader system in all of its complexity, and that has a lot going on in it. For example, the health system has thousands of elements: clinicians, administrators, medicines, devices, workflows, settings, practices, data sources, health programs, communication campaigns, insurance products, health institutions, research institutions, training colleges, apps, rules, laws, and all of these come together to hopefully create the health outcome that we want. Each of these elements is a potential point of design intervention for us to make things better. So why would we limit ourselves to a parochial view when we could instead zoom out and see the bigger picture of how people interact with different parts of the health system? Maybe the best health intervention is less direct, but much more effective. Maybe it's about the interaction between health insurance and pathology to drive earlier, clearer diagnosis. Maybe it's about setting up better adherence to treatment plans right from the outset, even at the hardest parts of treatment, far downstream from diagnosis. The point is that by zooming out, we've widened the range of places where we can intervene. And so a wider range of potential solutions suddenly present themselves to us. But we don't have to stop there. We can zoom out more. Because even the notion of health system is limiting. Humans don't pop into existence when they engage with the health system. They have rich lives, complex life journeys, and they engage well beyond the health system with what we might call the system of systems. Systems like the tax system, the welfare system, the employment system, countless others which shape our lives every single day. By understanding that people's health journey is one part of a larger life journey across many systems, our range for intervention suddenly becomes even greater. For example, we can move from the problem space to the prevention space and look at opportunities that attack root causes, not just the symptoms of the problem. And some problems can't be addressed parochially. We live in a world of contradictions where some people are corrupt, others astonish with the level of self-sacrifice they make to help people they've never met. Some people are open to progressive change, others seek to protect the status quo. Some see the world through the lens of evidence, others see the world through the lenses of fear or anger or disinformation. These forces are reflected in how systems work today. They're a mix of good and bad, of community interest and stakeholder interest, of evidence and assumption. So many of the grand challenges we face in the world today are intractable because of systems that basically eat any attempt at a parochial solution for breakfast without blinking an eye. At the beginning of my talk, I said that as designers, we run the risk of creating harm through unintended consequences on our journey towards impact. When we start designing interventions into systems, the risk of harm and the rewards of impact are much bigger than ever. So we need to be more than just system engineers. We need to be the engineers of ethical systems. What does that mean for our design practice? How do we make sure that we are being ethical system designers? There's no easy answer to that question, or maybe there are too many answers to that question, and it's about picking the right one for the right moment. I want to share a framework that I think is useful for designers and resonates strongly with our need for ethics and empathy in our design, noting that empathy without ethics has been weaponized to hook people on gambling, sell cigarettes, drive climate denial. Ethics is critical. This framework was created by renowned philosopher John Rawls, who talked about the power of using a veil of ignorance to help us create just, equitable, and sustainable systems and institutions. Rawls asks us to, and I'm paraphrasing him here, imagine that you are plucked out of your life and shrouded in a veil of ignorance. A veil of ignorance lets you forget about who you are. By donning this veil of ignorance, you're asked to leave behind your biases, your concern for ensuring that the system will benefit you or your family or your organization or your community in particular. Let me paint a picture. Imagine you wake up and see the world hanging in space beneath you. The memory of yourself has been wiped. You ask, who am I? And a voice answers, you could be anyone, male or female, a billionaire living in luxury or a single mother living in poverty, a farmer in Sudan or an accountant in Copenhagen. You may be in your 30s or your 80s or a newborn. Perhaps you're disabled. Perhaps you have dementia. Perhaps you're in perfect health and ability. So you ask the voice, why can't you tell me? The voice responds, I can do better than that. I can restore your memory and let you resume living your life, but not yet. First, I want you to design how the world should work. The rules, the power dynamics, distributions of wealth and privilege. You might say, but how can I design a world that will work for me if I don't know anything about myself? To which the voice might respond, well then, I suppose you'll just have to design a world that works for everybody. In designing systems, empathy is key to our practice, but to ensure that empathy is being used for an ethical outcome, we have to design in such a way that we strive for creating an impact for anyone that would reasonably accept it if they were wearing the veil of ignorance. It's a challenge so ambitious, it's absurd. But if we get even partway there, we're nudging the machinery of society towards a place that is more compassionate and more fair than ever. Thank you.
Thoughts in Darren, have you had a chance to look at the comments?
Yeah, look, I have, and really fantastic, especially the one about Morgan Freeman. I thought that was very insightful. But Sky's a point around at every point, understanding why we put forward what we do. And I think there was a comment in there around from the person's point of view, there's no difference between the health system and every other system. And I think human beings naturally understand that you have to look beyond constraints, beyond parochial solutions, beyond a particular system to look at the entire life journey and all the systems that underpin that. It's only when we become analytical and start to take a reductionist perspective that we leave that natural inclination to look more broadly and start to put constraints around ourselves. And often those constraints are driven by which agency you're dealing with, what organizational structure are you dealing with. They're very artificial and synthetic. And if you understand that, you can be empowered to call them out. And I think that's incredibly important in creating ethical change at scale.
Okay, so Mo's asking, you've got it, Darren.
Yeah, thanks. What are my thoughts around ethical design across studios? Look, I think it's a really interesting question. And there are two philosophies that really jump out at me in terms of how you answer that, and that might seem like an invitation for a boring bit of theory, but it's actually more interesting than that. Rushworth Kidder and Shalom Schwartz. So Rushworth Kidder, sorry, I'll start with Shalom, but he did a massive study of about 25,000 people, trying to understand what principles and what values guided their lives. And he found this massive level of convergence across cultures, across seniority, across economic divides, across linguistic divides. There was lots of response to it, to his multi-year survey. But ultimately, he found that there were 10 things that almost everybody agreed on. And those were the principles that governed their lives, and they said that they sort of lived by. Rushworth Kidder was another amazing philosopher, and he did a very similar study, but instead of asking people what guided their lives, he said, what values do you aspire to have? Not necessarily the ones that live in this world, but the ones that you wish would govern people's behavior. And again, he came to a very similar set of values. He came to 5 rather than 10, but you can map them to Schwartz's 10. And he also observed that people's aspirations tended to be similar across economic, across cultural, across geographic, across gender, across basically every single line you can imagine. We often think of the things that take us separate from each other, especially now in a world that is so incredibly partisan. And we think, how can we possibly come together? But the other than at the fringes, the truth that both Schwartz and that Kidder showed us was that there's more that bring us together than pull us apart. The problem is that the systems that we have designed organically, or that have been designed for us, sometimes challenge those values and make it very hard to actually implement them in our day-to-day life. So, when I think about what does it look like across different countries, across different studios, I think there is a similar thread that can be applied in everywhere. The challenge is, how do you activate those common values, those common ethics? Because in different countries, there are different problems with the sort of the systems at a nation's level. So the challenge is diagnosing your country's systems, your studio's systems, and where you think they create divergence from where humanity sort of wants to be.
Awesome. Definitely inspiring. I've been taking notes. Do you want to just quickly answer? We probably got less than 2 minutes. How do we get away from the unethical nudges like the use of shame?
Yeah, look, I think this is so incredibly important. And when I think what makes a nudge unethical, I think of nudges that are coercive. So shame is one example. Sometimes you actually want people to feel shame. You want them to feel shame when they're creating, say, suffering, or when they're doing something that really negatively impacts people's lives. But nudges are more subtle than that. You don't want to cause shame with a nudge. You want to gently invite a person to take a behavior or to take an action that's going to help them or the community. So I think, I always think with nudging, if it's overt but invites somebody, it is far more ethical than if it is obfuscated. If it is consent-based and the person can apply meaningful consent to engage in the nudge, then that's far more ethical than if it sort of tries to sneak one past somebody. The problem is that being ethical means that nudges are going to be a little bit less effective because you're not tricking people. And I think that's great.
Yeah, it's definitely something we've come across in our work in behavioral science and thinking about nudges, but also other behavioral interventions, and trying to ensure that it doesn't, feel and actually execute as manipulation.
And it's probably important to say that nudging has never been more powerful than it is today, because corporations, governments, everybody has got access to a lot more data. They've got access to a lot more powerful intelligences and algorithms. And we're only in the infancy of this sort of brave new world. We think that nudging is powerful now, but it's not going to take many more years before nudging becomes incredibly persuasive. And one of the roles of us as designers is not just to try and make sure nudges are ethical, but to start to put in place the cultures and frameworks that are going to support ethical nudging more systematically. So again, it's a systems problem.